So imagine you walk into a scene, right? And you find a victim sitting on the floor leaning forward.
Okay.
There's a ligature tied around their neck, and it's attached to a doorknob. Honestly, your very first instinct is probably going to be murder.
Oh, absolutely. It looks staged
Right, because you think, well, someone must have put them there. If they were doing this to themselves, I mean, they could have just stood up or just leaned back to relieve the pressure.
because they physically have the means to stop it.
Exactly. But that assumption, even though it's incredibly common from a forensic standpoint, it's actually completely wrong.
Yeah, totally wrong.
So today we're exploring exactly why the human body, betrays that basic survival instinct in a matter of seconds. Welcome to the deep dive.
Yeah, today we are really dissecting the forensic pathology of hanging because the body's the only witness left. And as a medical examiner, you really have to know its language fluently.
Exactly. So we're taking a stack of high-yield notes from the essentials of forensic medicine and really custom tailoring them for you, the listener. We know you're prepping for your forensic medicine exams.
Which is stressful, we know.
Oh, yeah. So our goal is to take what can sometimes feel like a dry table of textbook facts and just transform them into a bulletproof, memorable mental framework.
We'll cover the definitions, the causes of death, fatal periods.
Yep, the internal and external autopsy findings, and of course the medico-legal aspects. So let's just establish the baseline right now. Hanging, or self-suspension, is essentially a form of mechanical asphyxia.
Right. And the core defining feature here is that a ligature encircles the neck, but the constricting force is actually the weight of the body itself.
Yeah, and the clinical distinction we need to draw immediately is between complete and partial hanging.
Right. So complete hanging means no part of the victim's body is touching the ground at all, like a free fall suspension.
And partial hanging, like that doorknob scenario we just talked about, means the victim is, sitting or kneeling or lying down.
Which brings up a massive misconception to the general public.
Yeah.
People think you need the full weight of a suspended human body to cause a lethal constriction.
You really don't, right?
Not at all. The human head alone weighs roughly 5 to 6 kilograms, and that comparatively slight force is more than enough to be lethal if it's applied at the right angle.
Wow. Okay, so to understand what you're actually going to see on the autopsy table, we really need to understand the mechanics of how that slight force kills. Because it's not just a simple lack of air.
No, it's way more complex than that.
I like to picture the anatomy of the neck as this bundle of different hoses packed tightly together.
And that's a great analogy.
Right. So you have the airway, the trachea, which is like a thick reinforced vacuum hose with those cartilaginous rings.
Yeah.
Then you have the jugular veins returning blood from the head, and those are like thin, floppy garden hoses.
Perfect.
And finally, the carotid arteries pumping blood to the brain. Those are your high-pressure, thick-walled rubber hoses. And because they're structurally different, they fail at completely different pressures.
Exactly. So let's attach some numbers to those hoses because your examiners will absolutely ask for them. The textbook actually outlines 5 causes of death in hanging.
Okay, what's the first one?
The first is venous congestion, and it only takes a tension of 2 kilograms on the ligature to completely block the jugular veins.
Wait, 2 kilograms? I mean, think about the weight of an average house cat. That is all the pressure it takes to pinch off the venous return.
Precisely. Just 2 kilos. So the jugulars compress, and the blood can pump into the head through the arteries, but it just cannot drain out.
Oh, wow.
Yeah, so venous pressure in the skull rapidly rises, the face becomes engorged, and the person just loses consciousness.
Okay, so what about the second cause?
The second cause is cerebral anemia. So to block the carotid arteries, your high-pressure hoses, that takes about 4 to 5 kilograms of tension.
Got it.
And that completely stops oxygenated blood from reaching the brain. But to block the deeply protected vertebral arteries in the back of the neck, you need a full 20 kilograms of tension.
20 kilograms? Okay, so if 20 kilograms are needed for the vertebral arteries, a partial hanging might leave them entirely untouched, right?
Yeah, exactly.
So what about the airway itself, the reinforced vacuum hose?
Right, that brings us to our third cause, which is true asphyxia. To compress the trachea and force the base of the tongue up against the posterior wall of the pharynx, that takes about 15 kilograms of tension.
15. So looking at those numbers, 2 kilos for veins, 5 for arteries, 15 for the airway, it seems highly unlikely that a victim is dying purely from a lack of air.
Right.
I mean, the blood flow would be cut off way before the trachea collapses.
Yeah, you're deducing the fourth and honestly the most common cause of death. It's
Okay.
typically a combination of asphyxia and venous congestion.
Okay, so they happen together.
Yeah, the ligature rides up, the airway is partially occluded by the base of the tongue, and the venous return is simultaneously shut down.
Well, what about a scenario where the tension isn't high enough to fully block the airway or the vessels, but the person drops dead the second the noose tightens?
Yeah.
Because I read case studies where there's no sign of asphyxia or blood pooling at all. Is there like a neurological override?
Yes, there is. That's the fifth cause of death reflex vagal inhibition.
Right.
So the carotid sinuses and the vagal sheath are packed with these pressure sensors. If the ligature strikes these baroreceptors forcefully or suddenly, the brain registers this apocalyptic spike in blood pressure.
Wow.
And the parasympathetic nervous system panics. It
Yep.
triggers a massive reflex that just instantly stops the heart.
So there's no slow asphyxiation. It's just an immediate fatal cardiac arrest.
Exactly. Total system halt.
Okay, assuming vagal inhibition doesn't happen, the text mentions a fatal period. The time from suspension to death is typically what, 3 to 5 minutes?
Yeah, most hangings cause a gradual loss of cellular function over those few minutes. Assuming the cervical spine isn't snapped, of course.
Right, right. Let's extend that timeline a bit. If a patient is discovered and cut down quickly, say at the 2-minute mark, they have a pulse, they're breathing.
Okay, they aren't necessarily going to survive, are they?
Yeah.
Because the sources dedicate a whole section to delayed death.
Oh, yeah. Surviving the initial suspension is really only the first hurdle. Your examiners will definitely want you to know the clinical sequelae of delayed death.
So what happens?
Well, if a patient survives, they can succumb hours or even days later. The heavy hitters are hypoxic encephalopathy, pulmonary edema, and aspiration pneumonia.
Let's unpack the aspiration pneumonia for a second. Is that happening because the intense pressure of the ligature damages the laryngeal nerves? Like essentially obliterating the victim's gag reflex?
That's exactly it. The neurological trauma to the pharynx combined with the period of unconsciousness means that saliva, stomach contents, or blood can easily slip past the vocal cords.
Yeah, pools in the lungs, triggering a massive infection.
Yeah.
You also see profound brain infarction or abscesses.
Because the brain was starved of oxygen, which triggers that ischemic cascade.
Right. Even when you restore the blood flow by removing the ligature, the neurons are already undergoing apoptosis. I mean, the engine is unkinked, but the internal damage is terminal.
Okay, so if the vascular and neurological shutdown happens that violently, it has to leave a physical record on the tissue. Right. Let's step up to the autopsy table now.
Let's do it.
What is the very first external sign a pathologist looks for before making a single incision?
Well, the absolute hallmark sign is the ligature mark itself.
Right, and it's not just a simple red line on the skin. The groove, or furrow, usually starts pale, but as it dries out, it becomes this yellow-brown hard mark.
Yeah.
It has a very distinct parchment-like texture.
Exactly. The friction of the rope strips away the protective epidermis. So the underlying dermis is exposed to the air, and it simply dehydrates. It cures almost like leather.
Wow, and you can read the physics of the hanging right there in the geometry of the mark.
You really can.
It usually forms an inverted V pointing toward the site of the knot. So if the knot is at the occiput, the back of the head, the mark is deepest on the front of the neck and points upward toward the back.
Yep.
But if the knot is under the chin, the mark is deepest on the back of the neck and points forward. It's literally an arrow pointing to the suspension peak.
Yeah, that inverted V is a vital distinguishing feature. But you also have to prove the hanging actually caused the death, right? Rather than the person being killed first and then strung up to fake a suicide.
Ah, yes. The classic antemortem versus postmortem dilemma. You need vital reactions.
Exactly. Signs that the heart was actively pumping blood when the pressure was applied.
Because a simple line of congestion isn't enough, right? Fluid can settle postmortem through lividity.
Right. What you absolutely must know for your exams is that abrasions with hemorrhage along the edges of the groove strongly suggest the person was alive.
Because bleeding requires blood pressure. Okay, there is another detail here that proves the person was alive while suspended, and that's the dribbling of saliva from the mouth down the chin and chest.
Oh, yeah, that's a big one.
Why is that a definitive vital sign?
Well, salivation is an active physiological process, right? It requires secretion by the submandibular and parotid glands.
Okay.
So as the ligature compresses the neck, it physically squeezes those glands and stimulates the parasympathetic nerves. At the same time, the pressure prevents the victim from swallowing.
So gravity just takes over and the saliva dribbles down the chest.
Exactly. If a dead body is hung up, the glands aren't secreting, so you will not see that characteristic drill pattern.
That makes total sense. Here's another striking vital sign, and it has this great French medical term, le fascie sympathique.
The sympathetic face.
Right. So if the knot of the ligature presses tightly against the cervical sympathetic chain on one side of the neck, it causes the eye on that specific side to remain open, and the pupil on that side becomes dilated.
Yeah, you're essentially looking at a pressure-induced Horner's syndrome, an active neurological reflex like that proves the person's nervous system was intact and functioning when the pressure was applied.
But let's say the external signs are obscured, like maybe the victim used a very soft towel that didn't leave a deep parchment-like mark. Or maybe decomposition has set in.
Right, that happens.
If the mark on the skin isn't clear enough, what is the internal, smoking gun inside the neck?
The highest yield internal sign you really need to know about are carotid intimal tears.
Intimal tears. So the innermost lining of the artery is actually ripping.
Yeah, found in about 5 to 10% of cases. When you open the carotid arteries, you might see these transverse splits in the intima.
Oh, okay. So if the neck is being stretched longitudinally pulled up by the rope, it makes sense that the inner lining would snap transversely, snapping horizontally across the vessel.
Exactly. You're physically overstretching the high-pressure hose until the brittle inner lining just snaps.
Why?
And because these tears involve the extravasation of blood into the arterial wall active bleeding to the tissue, finding them is absolute proof that the victim was alive and had blood pressure at the time.
You would also look for muscle ruptures, right? Like the platysma and the sternomastoid muscles might be torn if the violence of the drop was considerable.
Yes, absolutely.
And you look for bruising at the base of the tongue, which happens when the ligature forces the tongue upward, crushing it against the hard palate.
Yep.
Okay, so I followed all of the neck anatomy perfectly, but when I was reading the source material, I hit a section on Simon's hemorrhages and thought I was in the wrong chapter.
Ah, the lumbar spine findings.
Yes. The text notes that in cases of hanging, you might find red strikes of hemorrhage in the lumbar intervertebral discs.
Yeah.
Why on earth would an injury to the neck cause bleeding in the lower back?
I know, it seems completely disconnected until you remember the environment the body is suspended in over time. Simon's hemorrhages actually have nothing to do with the trauma of the ligature itself.
Wait, really?
Yeah, they occur purely as a result of gravity and time.
Okay, so if a body is completely suspended vertically for a prolonged period, the blood just pools in the lower extremity.
Exactly. The intense pooling and hypostatic pressure cause blood to seep into the anterior longitudinal ligament and the outer layers of the lumbar intervertebral discs.
Oh, wow.
So if you find Simon's hemorrhages, it's a key forensic indicator not just of hanging, but of prolonged vertical suspension.
Fascinating. So the autopsy findings tell us how the body died, but forensics requires us to evaluate the scene and the circumstances to determine the manner of death.
Right. Was it suicide, an accident, a homicide, or a staged event?
And suicide is by far the most common manner of hanging, which brings us right back to the scenario from the very beginning.
The doorknob scenario.
Yes. You walk into a scene and you find a body in a kneeling or sitting or reclining position with the ligature around their neck. The instinct is foul play because, well, they could have just stood up.
Right. But finding a body in those unusual partial suspension positions is actually almost diagnostic of suicide.
That is so counterintuitive.
It is, but the physiology betrays our instincts. We assume that because the person has their feet on the floor, they have the cognitive and physical power to stop the process. But remember the pressure required for the carotid arteries.
Right. 4 to 5 kilograms, literally a bag of groceries.
Exactly. The moment the victim leans forward and applies that 5 kilograms of pressure to the noose, the arterial blood flow to the brain is cut off.
Wow.
Unconsciousness happens incredibly rapidly, usually within 10 to 15 seconds.
10 seconds.
Yeah, and once they lose consciousness, all muscle tone relaxes, their full body weight slumps against the ligature, and the grip tightens even further.
So they literally don't have the time, the oxygen, or the cognitive awareness to simply stand up or change their mind?
Exactly. The trap closes instantly.
That is terrifying. Okay, so if sitting or kneeling usually points to suicide, how does a medical examiner catch a staged murder, a post-mortem hanging?
Well, you look for the absences. We discussed the dribbling saliva as a vital sign. So if the body was dead before it was hung, there's no active salivation.
No saliva.
Okay. You also look at the hands. In a suicidal hanging, you will frequently find microscopic fibers from the rope or ligature on the victim's hands from when they tied the knot or adjusted the noose.
So if their hands are perfectly clean, that's a huge red flag.
Exactly.
And I guess you're also looking for other lethal violence, like are there drag marks on the body or the ground? Are there defensive wounds under the fingernails?
Yes, a staged scene almost always has inconsistencies that a methodical autopsy will just expose.
What about accidental hangings? The text mentions tragic scenarios like children entangled in blind cords or workmen caught in machinery.
Yeah, those happen. But there's a very distinct medico-legal category that examiners test frequently:
Yeah.
sexual or autoerotic asphyxia.
Right, these are accidental deaths that occur during solitary sexual acts where the person is intentionally inducing hypoxia to heighten arousal.
Yes, and the forensic profile of those scenes is highly specific.
So what are we looking for?
You will often find padding like a towel or soft fabric placed between the ligature and the neck.
Oh, because they're trying to avoid the exact parchment-like ligature abrasions we just discussed.
Correct. The knots are often highly complex too, and the scenes frequently feature mirrors or cameras.
Right.
But the tragic aspect of these cases is that they usually incorporate fail-safes designed to allow the person to escape, like a slip knot or a rope tied to a foot so they can release the tension at the last second.
But the margin of error is basically non-existent. I mean, unconsciousness hits in 10 to 15 seconds.
Right.
If the fail-safe jams or they misjudge the tension by just a fraction, they pass out and the partial suspension becomes lethal.
It's incredibly dangerous. Now, to wrap up the medical legal categories, we really must look at two specific historical and legal forms of hanging that drastically alter the physiological mechanisms we've discussed so far.
Lynching and judicial hanging. So lynching is defined in the text as homicidal hanging by a mob. And the name actually has a grim historical origin from a Captain William Lynch in the U.S. who ordered hangings without trial.
Right, it's chaotic, brutal, and homicidal.
But judicial hanging, on the other hand, is a state execution. And the physics involved are completely engineered.
Yeah, if a typical hanging is an asphyxial or venous death, a properly performed judicial hanging is actually neither.
Wow, okay. Because the mechanism relies on a calculated drop.
Yes.
The text notes a specific drop of 5 to 7 meters, calculated meticulously based on the person's weight and build, and the knot is placed specifically under the angle of the jaw, the submental position.
Right.
So what happens to the anatomy during that drop?
Well, this is where you see the classic hangman's fracture. With a 5 to 7 meter drop, the kinetic energy is massive.
I can imagine.
The sudden stoppage of the moving body, combined with the asymmetrical placement of the knot, causes the head to jerk violently backward and to the side.
So the energy doesn't just compress vessels, it actually shatters bone.
Yeah, it causes bilateral fractures of the pedicles or the laminae of the second, third, or fourth cervical vertebrae. So C2, C3, or C4.
And when those vertebrae fracture and dislocate, it causes a complete transection, like a pulping of the upper cervical spinal cord.
Yes, but more critically, the sudden traction tears the brainstem itself, specifically rupturing the tissue between the pons and the medulla.
Oh, wow.
And medulla controls respiration and heart rate, so the destruction of the reticular formation causes instantaneous, irreversible loss of consciousness. The destruction of the respiratory center causes irreversible apnea.
Meaning the heart and lungs receive an immediate shutdown signal from the neurogenic trauma. There's literally no time for venous congestion or cerebral anemia to even build up.
Exactly. Therefore, if the execution is performed correctly, there are absolutely no asphyxial signs on the body.
No petechias in the eyes, no swollen, dusky face.
None of it. Just instantaneous neurogenic shock.
Wow. Well, we have covered a massive amount of ground today to build your mental framework. We started with the physical limits of the neck, 2 kilos of tension for the veins, 5 for the arteries, 15 for the airway.
Right.
We explored the vital external signs like the parchment-like inverted V groove, the dribbling saliva, and that pressure-induced Horner syndrome of the facey sympathetic.
And we detailed the internal proofs of antemortem suspension, specifically the transverse carotid intimal tears.
Yep. We also unpacked why finding a victim in a sitting position strongly suggests suicide due to that terrifyingly rapid 10 to 15 second window of unconsciousness.
Yeah. And we contrasted all of that with the brute kinetic force of the hangman's fracture.
So you are now armed with the high-yield facts to decode the forensic puzzle of hanging for your exams. But before we finish, we want you to consider a broader thought that ties all this pathology back to our anatomy.
Right, think about the evolutionary vulnerability of the human neck.
It's pretty wild.
Structurally, human biology is heavily focused on protecting the airway. I mean, the trachea is armored with those thick rings of cartilage. It takes significant force, 15 kilograms, to crush it.
Because we're built to survive choking on a piece of food. But our true Achilles heel isn't our breath, is it? It's our blood.
Exactly. Our vascular supply, the jugulars and the carotids, are just laid bare. They are superficial and incredibly vulnerable. They require mere fractions of that force to completely shut down the brain.
We're astonishingly fragile when it comes to the simple geometry of a ligature.
We really are. It's not the lack of air that causes death first. It's the absolute collapse of blood flow.
It's a profound way to look at the anatomy you'll be testing on. Well, good luck on your exams, and we will catch you on the next deep dive.